We were just in this building a few days ago describing the work that state and local public health and our hospital partners have done because of the concerns about Ebola, and described our process for working with all the sectors to make sure that if someone from one of the affected countries, limited to Guinea, Liberia, and Sierra Leone, became ill, we would have a way to take care of them that assured patient, healthcare worker, and public safety. So we're here to tell you this afternoon that one of a female Portland visitor that had traveled recently to one of those three countries and was under monitoring, who had been well and had had no temperature, did develop a sustained fever this morning. Since public health was monitoring this, we knew about it immediately. We assured that it was a real temperature and that it still was there an hour later. And we then implemented the plans that we've told you about, which included having our EMS team go out and make an in-person assessment, wearing personal protective equipment, after which they assessed that in fact she did need transport for evaluation. While they were doing that assessment, we contacted our colleagues at the State Public Health Department as well as our hospital partners to make sure that there could be a smooth response. Once they decided she did need to be transported, that was arranged, and she was transported to Providence Milwaukie Hospital about 1 o'clock this afternoon.
So again, although we had hoped this wouldn't happen, we've been doing a lot of work to prepare for a potential Ebola case. Our staff and teams have been undergoing extensive training in preparation, as well as facility preparation for accepting a potential Ebola patient. I give a lot of credit to our teams for being ready, for being fully trained and prepared. We have the equipment necessary. We've been following the guidelines and direction of CDC and our partners here in the state and county in terms of how to best deliver the care and the best protocols and so on. We are fully staffed. We actually had about 550 employees trained and prepared, and those folks voluntarily agreed to be trained and prepared to serve a potential patient in this case. And actually we had established Providence Milwaukie as a training center in preparation for, we would hoped this would not have happened, but certainly are ready now and are treating the patient following all the appropriate protocols.
So let me address the next steps. So there are many causes of fever, and because of the concern about travel to this particular country, in addition to other more routine causes of fever that you could get anywhere, or other causes of fever such as malaria that you could get from the continent of Africa, the patient will also be tested for Ebola. The testing is being obtained, and we will be working with our what's called the Laboratory Response Network and the CDC to get that testing completed as expeditiously as possible.
When do you expect results?
We expect results when they're available. Again, the CDC confirms all results, and you've seen this play out in the other patients around the country, that there can be preliminary results, but then they're finally confirmed by the CDC. So since we're here and they're there, there will be a day to get it there, and then time for them to run and confirm the test. But regarding public concern, again, we think that the system worked almost flawlessly here. Someone was at some risk. They were monitored twice a day. As soon as they developed symptoms, they were evaluated and moved safely to get definitive evaluation and care. Since there were no symptoms before that, and there was no public exposure before that, there's no risk to the public.
We do follow the CDC guidance, and they do have categories of people that are under risk, and this person was at low risk in the category. So while having been in the affected area of Africa, did not have any known contact with Ebola patients in those countries.